Hi, my name is Katarina Monahan, and this is my group theory presentation for DBT. So some important terms and definitions to know ahead of time. DBT stands for dialectical behavioral therapy. I'm going to talk about the four pillars of DBT, which are mindfulness, distress tolerance, interpersonal effectiveness, and emotion regulation. Mindfulness is being able to non-judgmentally observe yourself and your surroundings. Distress tolerance is dealing with painful situations. Interpersonal effectiveness is changing the way you communicate in your relationships. And emotion regulation is learning to make your emotions work for you. A couple of other terms that I might talk about are thesis and antithesis. These are two opposing internal forces essential to dialectics. So what is DBT? Dialectical behavioral therapy is a broad-based cognitive behavioral therapy treatment that was developed in the 1970s by Marshall Linehan. And it was created for individuals with chronic suicidality first. And then secondarily, it started to get used on those who've been diagnosed with borderline personality disorder because that demographic deals with a lot of suicidal ideation and suicide attempts. It is used today to treat a variety of disorders, but I will get into that later in this presentation. So the dialectics worldview has two meanings when applied to behavior therapy. It's the fundamental nature of reality and that of persuasive dialogue and relationship. And the dialectical perspectives on reality and human behavior share three common characteristics. The first is that dialectics stresses the fundamental wholeness of reality, meaning that in DBT, you view individual parts of the system to be of lesser value than the entire system as a whole. DBT still looks at the individual parts of the system, but puts a lot of emphasis and importance on the wholeness and interrelatedness of everything. For example, a DBT skills group will look into skills deficits and their interrelatedness. And it's hard to learn a new skill set without learning the other skills as well. So the individual skill set is nothing without the whole skill set of DBT skills. The second perspective is that reality isn't static. It's made of internal opposing forces, the thesis and antithesis. And their synthesis creates a new set of opposing forces or polarities that individuals can get stuck in. The DBT manual by Marshall Linehan talks about a few polarities that people can get stuck in. And the first is being between accepting themselves as they are in the moment and the need for them to change. The second is the tension between a client's getting what they want or need to become more competent and losing what they need if they become more competent. The third polarity has to do with clients maintaining personal integrity and validating their own experiences of their difficulties versus learning new skills that will help them emerge from their suffering. The third perspective on reality and human behavior is that DBT is an assumption following the two characteristics already mentioned, and that the fundamental nature of reality is change and process rather than content and structure. So how does DBT work? It uses the four pillars of DBT, which are skill sets focused on mindfulness, interpersonal effectiveness, emotion regulation, and distress tolerance. Linehan developed this theory on the understanding that at its core, suicidality and borderline personality disorder are disorders of intense emotion dysregulation. And it's as a result of unbearable emotional suffering. The suffering causes instability in affect regulation, impulse control, self-image, and interpersonal relationships. To really understand DBT, you have to understand what emotions really are. Linehan proposes a definition for the construct of emotion as brief, involuntary, full system responses to internal and external stimuli. So according to DBT, emotional responses are systemic and made up of interacting subsystems that include emotional vulnerability cues, internal and external events that attend to and serve emotional cues, or also known as prompting events, appraisal and interpretation of the cues, response tendencies, including neurochemical and physiological responses, experiential responses and action urges, and nonverbal and verbal expressive responses and actions. And then the last kind of part of an emotional response is the after effects of the emotional firing or the response itself. All of these interactional systems make up the emotional system, and DBT emphasizes that modifying any component of the emotional system is likely to alter the functioning of the entire system as a whole. So some functions of DBT treatment is to enhance an individual's capability by increasing their skillful behavior, and improving and maintaining the client's motivation to change and engage with their treatment, ensuring that generalization of change occurs throughout treatment, also enhancing a therapist's motivation to deliver effective treatment. It's used to assist individuals in restructuring or changing his or her environment to support and maintain progress, and just overall advancement towards personal goals. It is recommended that treatment be spread out amongst different types of providers. So they recommend that clients in DBT also have case management services, individual therapy, individual skills training outside of the DBT group, between session coaching, and consultation with an entire team. And this team can include psychiatry, other mental health practitioners, peer support, anybody else that's part of the entire treatment team, primary care doctors, everything. So a standard DBT cycle is divided into 4 skill modules. Each module that I mentioned is one of the pillars, and it's taught usually in 6 months, but it can be taught up to a year. Each individual module is divided into core sections and supplementary sections with specialized optional advanced skills are provided as needed. Typical groups have 6 to 8 members in them, 10 at most, and there's usually a leader and a co-leader that facilitate the group. And sessions on average last about 2.5 hours once weekly. Individuals in the group will complete 1 full cycle in 6 months of all the modules. However, for more intense treatment, people can repeat the program for a full year. And so they would repeat the cycle for another 12 months. And of course, changing the homework and other things within the modules just to be relevant to the treatment cycle. So group leaders and co-leaders run the session in modules that address each individual pillar of DBT. The role of the group leader is a little complicated because there are typically 2 leaders for each group. So in a standard DBT group, there's a co-leader and a leader, and their functions differ within the setting. The leaders typically begin the meetings. They conduct the initial behavioral analysis. They present new skills material, and they're responsible for keeping time with the session, moving from one person to the next person as time allows. And then the co-leader functions as a more diverse participant within the group. They provide balance and mediating tensions. They look at each member individually, opposed to how the leader looks at the whole entire group. They take note if someone needs any of individual attention and addresses that, or consults the leader during a break. The co-leader also serves as a tutor and teacher. They offer alternative explanations to examples or examples. The co-leader may also move seats to assist individuals, with individual assignments and provide more support. They track homework assignments, which is most important when individual assignments are given to one or more participants. According to Linehan, the group leader is seen as more of the bad guy in the situation because they also enforce the group norms. And then the co-leader is seen as the good guy because their role in the group is to see life from the point of view of the member who is struggling. So Linehan does state, though, that as long as both leaders keep a dialectical perspective of the whole, the division of labor within the group can be quite therapeutic. I want to mention that I did focus a majority of my information on group DBT skills training opposed to individual, but I thought it was important to mention the roles of an individual DBT practitioner, which is to provide crisis management services, to prompt the use of clients to use the skills that they have learned to replace dysfunctional behaviors, provide coaching to handle crisis calls for group members that might be needed due to the immense caseload that a DBT practitioner has already. They can't attend to the individual needs of all 10 members of the group. So the individual skills provider outside of the DBT group would attend to these needs. And it's really important to have a combination of DBT skills group with an individual skills practitioner on the side, because they can help reinforce the skills that the client's learning within the group. So a couple of specific interventions that I thought were interesting that I decided to talk about. The first one is the STOP acronym, and this is for distress tolerance, and it stands for stop, take a step back, observe, and pull back, or proceed mindfully. And this intervention is used specifically when individuals are feeling their emotions are about to take control of them. And this is to help remind people that in a crisis situation to stop first before reacting, and to remember that you are the boss of your own emotions. The second intervention is also an acronym, and it's DEAR-MAN for interpersonal effectiveness. And it stands for describe, express, assert, reinforce, mindful, appear confident, and negotiate. This is an important intervention that helps individuals learn to ask for things to get their needs met in a healthy way, to set boundaries and say no, to maintain their position when discussing their personal viewpoint, and to achieve other interpersonal objectives. So in DBT, when it comes to multiculturalism and diversity, Linehan had a few sections on this, and I wanted to point out first that in Western culture, so in like our culture, my culture, it really promotes judgmental behaviors. And DBT seeks to teach people who are motivated to change that figuring out and modifying the cause of their behavior works far better than judging and blaming people. It's really easy to react in a judgmental manner just based on our cultural beliefs and values. So letting go of judgment is likely going to be helpful in changing behavior and reaching goals. Another really interesting piece about different across cultures, according to Linehan, there's research that shows in all cultures that there are some facial expressions that are linked to the same basic emotions. So a change in facial muscles when emotions are activated is essentially universal, and people are extremely sensitive to facial expressions, and this starts in early childhood and onward. So facial expressions for many of our most basic emotions are the same across cultures, and the importance of facial expression in communicating with others is likely to be very important to our survival. Another thing to keep in mind is what works for one culture may not work for another. Linehan recommends being savvy about people, so meeting them where they're at opposed to where they should be and going from there, and just understanding that their cultural beliefs may impact the homework and the way they view the DBT group as a whole. Spirituality is a really huge part of many cultures, and mindfulness is an incredibly old practice, and it's heavily rooted in spiritual practices as well. So I thought that was a really interesting connection. Mindfulness is used all over the world, and it has been for a very long time. One of the recommendations that's made in one of the articles that I reviewed for this assignment is adapting DBT homework. So this is something that's really easy to do within a session. And so their example was there was a study done on women of Chinese descent who have eating disorders. And so balance and harmony is something that's really important to Chinese culture. And it's something that's really deeply rooted in mindfulness as well. So tailoring homework around cultural beliefs and values is one way that you can be very culturally informed when providing DBT services. Unfortunately, there is a lot, there's very limited research on the efficacy across multicultural groups. There are the ways, of course, to adapt DBT skills homework and tailor it to specific cultural groups, but ultimately there's a lot more research that's needed on how DBT specifically affects different cultures and ways that we can improve it. Some strengths and weaknesses. So populations that benefit the most from DBT treatment are those with anxiety disorders, depression, eating disorders, addictions, and of course, chronic suicidal ideation or suicidal attempts, and borderline personality disorder. I wasn't able to find any really peer-reviewed articles that talk about what DBT is recommended against, but I did find a website about who benefits and who doesn't, according to a certain counseling center, and they state that DBT is not recommended for people with intellectual disabilities. There's conflicting information about post-traumatic stress disorder. Some articles have said that DBT is good to treat that. They recommend not using DBT with people that have PTSD and panic disorders with agoraphobia, which makes sense because DBT skills groups are very social, and agoraphobia is the exact opposite. Psychotic disorders. This makes sense as well, since DBT is heavily rooted in the fundamental nature of reality, and in psychotic disorders, reality is often distorted. Meeting them where they're at, that is their reality, but it's not the reality that we share. But there's really not enough research that has been done on who does not benefit from DBT, from what I was able to find. Some other weaknesses, the length of treatment. 6 months is a long time for a skills group, but 6 months is pretty average, I would think. But completing a year of the program, that's quite a long time. And it's a huge time commitment because it's 2.5 hours out of your week, including individual sessions outside of the group, and having to do homework. And then motivation to change. If somebody doesn't think that they need to change, DBT is not going to work for them. You have to be 100% ready and accepting of the fact that you have behaviors that you need to change in order for DBT to work well for you. So Joe's story. So just to recap, Joe is a 24-year-old male who was referred by another therapist to join the process group. He experiences anxiety and has struggled with progress in individual therapy. He reports that he's been to hundreds of therapists, and it appears that he's incredibly frustrated by his lack of progress, or the inability to find the help that works for him. His anxiety comes out in the group as people share their stress of their own lives, leading him to react negatively in ways that aren't appropriate for a group setting. And it ends up causing some conflict. One participant gets verbally angry, and another participant reports that they won't be attending group next week. So just applying the theory, there's obvious emotion dysregulation amongst many people in the group. So DBT would probably be a good choice to use here, but there's not enough information to really make that decision, because I don't know all the history of every single group that's in there, every single person that's in the group, sorry. Distress tolerance. Joe being present in the group has caused distress to both himself and others in the group, and it appears that people are having a hard time tolerating it. There also appears to be challenges with Joe's ability to maintain relationships and communicate in a healthy and effective way. So there's some interpersonal issues that I'm seeing within this case study. Several members of the group appear to struggle with their emotion regulation, the female in particular who voices her emotions very loudly. And then mindfulness. Joe appears to have issues observing himself and his surroundings in a non-judgmental way. So I believe he did make some judgmental statements toward one participant about why don't you just leave your girlfriend, opposed to really talking it through. So picking one skill, I decided to pick a fun one that I had learned about many, many years ago. These are actual pictures of eggs that I've balanced, but it's a mindfulness activity and it's balancing an egg. So why would you balance an egg in this group? The first thought I had is that the group is experiencing a lot of emotion dysregulation and they could definitely use some stress management. And this is a good activity for both of those. So when you're balancing an egg, you're focused completely on the egg. Yes, you're going to get frustrated and you're going to feel it's impossible. However, it isn't. You can do it. So it's a really good mindful activity to keep your mind focused on one thing at a time and help you really try to modulate and regulate your emotions while you're doing it. And I thought that this would be a fun activity for the entire group to do because there's a definite lack of cohesion with Joe's entering the group and causing some distress to some participants. And it kind of will level the playing field for everybody because everyone will be in the same spot. Everyone will be trying to balance their own egg. They'll all be frustrated and together. They'll all fail together and they'll all succeed together. So I thought that bringing some cohesion to the group might be beneficial to everybody as a whole. And then just mindfulness, because it appears like a lot of people struggle with anxiety in the group, dysregulated emotions. And so having everybody engage in an out-of-the-box mindful activity, I thought would be a good intervention to use with this particular group. I'm not sure if that's the right thing to do, but I thought that it would be a good thing for people to try. So if you haven't tried balancing an egg, you should, because it is quite rewarding. It's very difficult, but it's rewarding. And that is my presentation. I hope you enjoyed it. Thanks.